Welcome everyone back to our BE school. We're treatment edition. I'm Rebecca Hall. I'm a massage therapist and an athletic trainer that works at Happy Valley Bodyworks here in State College. And Dr. Emery Pitcel here can introduce himself.
Yeah, Dr. Emery Pitcel, Rothrock, Chiropractic and Rehabilitation. Absolutely love doing collaborative type work with Rebecca Hall. She's fantastic, and you're going to see why in just about a second here.
I appreciate that. Well, thanks for joining me.
Yeah.
So today, earlier this month, we kind of talked about the plantar fascia and plantar fasciitis. So today we just wanted to go over a couple things. I am going to show you one muscle technique that I really like, stretching wise and kind of massage therapy-esque, getting into the muscle there. And then also more of an active mobility stretch that I really like to do with somebody that's dealing with kind of a recovering side of the plantar fasciitis. So if you're ready, we'll go ahead and get started.
That's ready. I'm excited. Let's do it.
All right, perfect. So I'm going to have you lay face down on the table here.
Absolutely.
All right, so what I'm going to do is I'm going to work a little bit on his soleus here. So I always have them bend their knee up first. Now, the reason that I do that is to take the gastroc out of it. So we have two big muscles in our calves, right? We have our gastroc and our soleus. And our gastroc covers both the knee here and the ankle joint. The soleus just crosses that ankle joint. So by bending up his knee, I just kind of take that gastroc out of it a little bit. And then really what I'm going to do is I'm going to start kind of on the inside here, right around his Achilles. So I have his Achilles tendon, so right on the inside of that, about midway up of his calf. And I'm going to work on, I kind of pull back and then I just push that foot down. What I'm doing is I'm just kind of trying to strip along that soleus there. Does that feel okay for you?
Yeah, it does. Remarkably a little more tender than I thought it would be.
It is a little bit of a sensitive area, so just be careful if you have clients that are a little bit more hypersensitive. This can be a little bit intense. So if I wanted to make it less intense, right, I maybe don't dorsiflex the foot as much or actively as I'm doing it, and I can just do that straight pull. Feel a little bit different with that one.
It does, and it's still plenty intense, but effective intense.
Yeah, definitely. So you can mix it up depending on how much your client needs, and then using your body weight to kind of do that active assistive or passive range of motion to kind of get on that soleus, right? So I would do that, and then I kind of just do a little bit of a trigger point pull there. And you can also switch your hands a little bit so you kind of get both sides of it, right? So you're going to get more of it on the medial side, but you can kind of dig into that lateral side a little bit as well, as you're kind of working up the calf. Then I'll just show on both sides because, again, we don't want you to be lopsided as you walk out of here. Yeah, I feel like you're maybe a little bit tighter on this side, so I'm actually going to hold here for a second. Just let that relax. We'll kind of get into a little bit of that passive active assistive range of motion here with that. Still feeling okay?
Yes, it is.
Perfect.
Yeah, and that's neat that you can find a spot that you feel like needs a little more attention and be like, we're just going to stay here for a few extra seconds and let it melt, right?
Yep, absolutely. That's a nice thing about trigger points, and we'll do a little bit on the lateral side, is sometimes if you just give them a little bit of TLC, it goes a long way. And I don't often have to maybe dig into that like deep tissue as much, because if I can just do a little bit of overpressure and get that to relax, I can actually go deeper into the muscle without even having to expend the effort, which is great. All right, so that's kind of the first technique that I was going to do, and then I'm going to actually have you stand up if you're okay with that.
Yeah, certainly.
So for this next one, I'm going to kind of show you guys an active mobility activity that I really like to do with a lot of my clients that have really bad calf tightness, but especially are recovering from this plantar fasciitis. So we're going to work on that windlass technique a little bit. That if you watched our video earlier in the month, you'll be familiar with. But what I'm going to have you do, you're going to put your foot up on the table here, and you're going to put your big toe on this lacrosse ball, and then I'll kind of show you the stretch that I want you to do with this. So yeah, we can lower.
I'll drop it a little bit. I'm not the most flexible guy in the world here. We'll do the right side since you pointed out more tenderness there, right?
Perfect.
So we're kind of doing this, and we've got the big toe up on the cross ball.
Yep. And then what you're going to do is you're just going to drive this knee forward and back until you feel that heel, like right before that heel starts to lift.
The heel's about to lift. Yep.
And then you're just going to kind of relax back. So what I like to do, you can do it just in the forward and backward plane, or I can have you as you come back, you can come angle in. So you're kind of doing like a three-way
So
and
we're
then back
going
out.
aiming for like 11 o'clock or 10 o'clock,
Yep.
right?
And then you can do 1 or 2 o'clock and kind of aim out, and still trying to keep that heel as much on the ground as we can, right? Now this table is a little bit of a soft surface,
It
so a lot of
is.
times I like to do more of a surface, like a hard surface, so like on the floor, and you can just put that lacrosse ball right against a wall or a table or something that's going to hold it.
Mhm.
But that's a really, really good way to stretch kind of all areas of that soleus and that calf muscle, as well as getting into that plantar fascia.
Yeah, yeah. And then, like you said, advantage, because we talked about earlier too, how important is it to have big toe flexibility and mobility?
So important.
So when you're taking that and we're loading and we're actually not only just taking care of the plantar fascia, but improving the functionality at the big toe, it's going to just holistically tie everything in together. So I like this. This is good.
I'm glad you like it.
Yeah.
Glad I could show it for you.
Yeah.
But yeah, so those are kind of our 2 big techniques that we worked on today, just kind of stripping through the soleus and trying to get some of that like passive active range of motion with it, to kind of get that to release a little bit more, working on those trigger points. And then obviously once you're able to kind of tolerate it, right, if you have plantar fasciitis or any kind of tension there, doing some of the 3-way knee to wall esque mobility to kind of get that calf really to stretch out once you've reduced the adhesions. So but yeah, that's all I have for today. So thank you so much for joining me, Dr. Emery. It's always a pleasure to collaborate with you.
Yeah, thank you.
If you guys liked the video, please like it, share it with all your family and friends. Come see us if you need, or if this seems familiar. Please come see us, watch our other videos, and come join us. But again, I'm Rebecca Hall with Happy Valley Bodyworks and State College. And
Dr. Emery Pitcel of Rothrock, Chiro.
Awesome.
Yeah.
Thanks so much, guys. We'll see you again next time.
Yeah, we'll talk to you guys later. Thank you.